Hi, how are you?
Good, how are you?
Good. How are you doing today?
Good, thanks.
All right, so we're here for a physical.
We are, yeah.
How are you feeling? How's everything?
I'm doing well.
Well, good. You look good just by looking at you.
Thanks.
Okay, so first we're going to start with some questions.
Sure.
And then we'll go over your lab work, and then we'll sit down and I'll do a head-to-toe full assessment on you.
Perfect.
Okay. So let's start with this. And you have the package that I gave you with the questions if you want to refer to them. So when was the last time you were here?
Probably about a year ago.
Okay. Any questions about that visit? We followed up on everything.
Yeah, I think we talked about all of it.
How, your weight here is 110 pounds, I see, that we weighed you this morning. Very nice.
Yeah.
Your height is still the same, 5'4".
Yep.
Okay. Do you wear a seatbelt still when you drive?
I do, yes.
Okay. Always?
Always.
Okay. Do you feel safe at home?
I do.
Okay. Any issues, any hazards that you're concerned about?
No.
Okay. How do you perceive your own health?
I would say it's fairly good. Good.
Good. Okay. Good. Be honest.
Yeah, no, everything's good.
Okay. And do you regularly monitor your blood pressure?
I do, yes.
Okay. And no issues with your systolic and the diastolic, the top and the bottom number?
Right, 120 over 70.
Good, good. And you exercise, so we expect your heart rate
Yeah.
to be lower at baseline.
Yeah, I would say like in like the 60s every time I measure.
Good. So you're positive that you don't have high blood pressure, and then when I do the assessment, we're gonna double check that, but not that you know, you're aware.
Right, I'm not aware that I have high blood pressure.
And no medications in the past for high blood pressure?
Nope.
Okay. Do either of your parents have high blood pressure or history of blood pressure? High blood pressure? No.
No.
Okay. Have you ever had a heart attack?
No.
Okay. Did either of your parents ever have a heart attack?
Nope.
And I know this, but you still exercise regularly, just like last year?
3 times a week at least.
3 times a week. And 0 to 10, how would you describe the intensity of your exercise?
Well, it depends on what I do, but usually I take spin class, and I take pretty high intensity spin, so I would rate it like an 8.
An 8, okay. And how long do you take the class for?
About an hour.
And your usual workouts are about how long?
When I'm not at spin class, also I try to aim for like an hour.
Okay, good. It's very good. Very healthy girl.
Thank you. I try.
And anything else besides cycling that you like to do?
I like yoga.
Okay, good.
I like yoga.
Any chronic back pain or any pain?
No.
With the exercises or when you're not exercising?
Nope.
Okay, good. And I'm sure yoga helps with that. That's a good thing to have to back yourself up. Do you have any chest pains at rest or after exercise?
No.
Okay. Have you ever been told you have high cholesterol?
No.
Okay. Do you ever get leg cramps or do your feet ever turn blue?
No.
Okay, good. What about after walking?
No.
I know you're a nurse and you work long hours. Any issues after your long shift?
No, sometimes I wear those compression stockings.
Good. Those are very, very good things to wear.
But no issues otherwise.
Okay. And no history of stroke?
No.
Okay. What about your parents? Do they have history of stroke?
No.
Okay. Have you ever used tobacco products?
No.
Chewing or smoking?
No.
Okay, good. Have you ever had a dental oral exam recently?
About 6 months ago.
Okay. Any issues, infections? No.
Nope.
Okay, good. Do you have trouble breathing or ever short of breath?
No.
Obviously, with exercise, it's normal sometimes to get short of breath, but nothing at rest or when you walk up a flight of stairs, no shortness of breath?
Nope.
Okay, good. Do you snore?
I do not, that I know of.
Have you ever? Okay, never, or anyone?
No
has
one's
told you?
ever.
Okay. Back to the smoking. I'm sorry, I forgot. Does anybody in your household smoke?
No, absolutely not.
Okay. Do you have any history of cancer?
No.
Okay. What about your family, your parents? Any history of cancer?
Nope. Not that. Nobody. Not that anyone knows of.
I'm so aware of. Okay.
Yeah.
If you come up with something, just let me know. It's okay. Sometimes comes up. Have you ever had a colonoscopy?
No.
Okay. So after 50, after you turn 50, you should get those
Right.
regularly. Have you ever had a mammogram?
No.
Okay. After 40, it's recommended that you start getting those. Do you perform your own breast exams at home?
I do.
Okay. How often?
Once a month. About a week after my period ends.
Okay, good. And have you ever noticed anything abnormal?
No, never.
Okay, and so never a breast biopsy or anything of such?
No.
Okay, do you have breast implants?
No.
Okay. Have you had a pap smear in the past 3 years?
Yes.
Okay, how often do you get those done?
Yearly?
Okay, any abnormal findings?
No.
Okay. Are you taking any hormones?
No.
Okay, good. And are you sexually active?
No, I'm not.
Good, but if you are, you know ways to prevent STDs and things
Yes.
like that, and just to be safe.
Yes.
Correct. And if you have any questions, we have pamphlets and everything where and sources where you can find those answers and other professionals that can help you with that.
Thank you.
So, and not taking any hormones.
No.
Okay. Not on birth control for other reasons besides.
No, I don't take any medications.
Okay. Do you have kidney or urination problems?
No.
Do you ever have pain in the back sides?
No.
No. Okay. Did you ever have a urinary tract infection or a bladder infection?
No.
Okay, good. Do either of your parents have problems with their kidneys?
No.
Ever kidney stones?
No, not that I'm aware.
Okay, good. Did anyone ever tell you that you have high blood sugar or diabetes?
No.
Anyone in your family have history of diabetes?
No.
Okay. Do you ever have problems with your weight?
No.
Your calculated BMI is great here, so and you're active, so
Yeah.
everything looks good so far. But are you ever up and down? Do you diet a lot?
No, I just like to watch what I generally like to eat healthy. I don't like to eat a lot of fried foods or anything like that.
Good.
I like
Very
to
good.
stay away from anything that can prevent me from staying at my ideal body weight.
Very good. Do you have stomach or heartburn or gas problems?
No.
Specifically after certain foods that you eat?
No.
Anything that you noticed?
No, I have a pretty strong stomach, fortunately.
Good. Have you ever vomited, specifically vomited blood
No.
without any cause?
No.
Do you take any anti-inflammatory drugs such as ibuprofen, Advil, Motrin, Aleve?
I mean, for headaches occasionally, but very rarely.
What onsets those headaches usually?
A lot of times stress. I'm in school and with work. Sometimes, at the end of a long day, I get a headache, but nothing, nothing abnormal, nothing that I can't be explained.
Are they regular or are they once in a while? How often would you say you?
Once in a while.
Okay, and the headache does go away with one of the anti-inflammatories?
Yes.
Okay, good. And you know that if it's described as the worst headache of your life, you should, and it's not, doesn't go away with one of these medications, you should go to the emergency room.
Yes, I do.
Have you ever been told that you have blood in your stool? Have you ever noticed that you have blood in your stool?
No.
Okay. Have you ever been told that you have liver disease or hepatitis?
No.
Okay, good. Do you travel a lot?
Occasionally I like to travel, yes.
Okay. And you get the immunizations appropriate if you're traveling to countries that recommend hepatitis B shots?
I don't travel to those countries, but if I did, I would.
Okay, good. Hepatitis A and B, I should say. Do you drink alcohol? Wine, beer, any kind of liquor?
Maybe socially. I don't particularly like to drink.
Okay. How many glasses a month would you say, or a week?
Maybe I'll wait. Maybe 2, 1.
Okay. Okay. Good. Social drinker. Good. Okay. Do you stop drinking because you had a problem? Is that why you're just a social drinker, or?
I'm very health conscious.
Good.
So.
Good. Do you ever feel guilty about drinking alcohol?
No.
Okay, good. Do you have a history of depression or any kind of health illness?
No.
Decrease in wanting to do your daily activities or go to work, go to school?
No, not particularly, no.
You seem like you're a very upbeat woman, so good.
I try.
Have you ever felt down or felt blue lately at all?
No. I mean, I like to be optimistic about everything in life, so
good.
I have great family and great friends.
So you have a good support system if you did need something?
Absolutely.
And once again, we have resources here that you can come and receive if you don't have anyone outside in your family or your friends that can help you. So feel free to, and it's very confidential. So
great.
Okay. Have you ever felt like hurting yourself?
No.
Okay. Do you feel, how would you describe, you did previously say you feel stressed sometimes. How would you describe your stress? Or is it excessive stress? Is it regular life stressors, just kind of to categorize
Yeah,
it?
probably just regular life stressors, nothing excessive or out of the ordinary, you know, regular work, school stuff that
Okay.
I'm sure everybody else goes through as well.
Okay. And how do you deal with that stress?
I talk to my friends or my family where I work out. I take a walk in the park.
Good.
So
So you have coping mechanisms, even though that's regular stress, it's that everybody that you think faces.
yeah,
It's still important that you have coping
Yeah.
mechanisms to deal with that,
yeah,
not to have a bad impact on your health.
yeah. Well, good music helps too.
Good,
so.
yes, it sure does. What do you like to listen to?
I like to listen to very ambient music, you know, calming, soothing stuff, and yoga also helps me deal
Good.
with stress. So
Good.
I have my outlets.
Good. What was I talking about this? Okay, do you, and you stated previously that you don't take any medications.
Right.
What about besides the NSAIDs, but what about vitamins or anything for your metabolism, like fitness, protein shakes,
No.
anything like that?
No, none of that. I used to take a multivitamin, but have stopped.
Okay. Okay. So we'll do a head-to-toe exam on you, and then we'll go over your lab work, and then whatever other questions you have for me with the assessment, we'll go over that. But so far, do you have any questions for
No,
me?
no, you're very thorough. Thank you.
Okay, thank you. All right, I'll be right back, but I'll give you some privacy, put on your gown, and sit on the bed, and I'll come in and do a head-to-toe exam on you, okay?
Sure.
All right, and I'll knock before I come in.
Great. Yep.